Welcome to Expert Living, your trusted channel for in-depth discussions on major health problems and practical solutions to help you live a healthier, more fulfilling life. Today's video is dedicated to understanding a condition that remains one of the leading causes of death worldwide, coronary artery disease, or CAD. This topic is vital for anyone who wants to protect their heart health or better understand the risks and treatments for a loved one. We'll cover the nature of this disease, its symptoms, causes, and the variety of treatment options that can make a significant difference in managing it. By the end of this video, you'll have a clear understanding of what coronary artery disease is and how to approach treatment effectively. Make sure to stay tuned until the end, where we'll summarize everything and give you actionable insights for your health journey. What is coronary artery disease? Coronary artery disease is a condition that develops when the coronary arteries, the blood vessels responsible for supplying oxygen-rich blood to the heart muscle, become narrowed or blocked. The heart, being one of the most vital organs, relies on a consistent flow of blood to function properly. When that flow is restricted, the heart struggles to pump effectively, which can lead to severe health consequences like chest pain, heart attacks, and even heart failure if left untreated. The narrowing or blockage is most often caused by a buildup of plaque, a combination of fatty deposits, cholesterol, and other substances found in the blood. Over time, this plaque can harden or rupture, creating a more dangerous scenario. When plaque hardens, it narrows the coronary arteries, limiting blood flow to the heart. When it ruptures, it can cause a blood clot, further restricting the passage of blood, potentially triggering a heart attack. What causes coronary artery disease? The primary cause of coronary artery disease is atherosclerosis, which is the buildup of plaque in the arteries. But to truly understand why this occurs, we need to consider a range of risk factors that contribute to this condition. While some of these factors are within your control, others are not, which makes it all the more important to be informed and vigilant about heart health. The most common risk factors include high cholesterol, high blood pressure, smoking, diabetes, obesity, and a sedentary lifestyle. High levels of LDL cholesterol, or bad cholesterol, play a key role in forming plaque. Similarly, high blood pressure can damage the inner lining of the arteries, making it easier for plaque to build up. Smoking not only contributes to this damage but also reduces oxygen in the blood, making the heart work harder. Diabetes increases the likelihood of atherosclerosis due to the high sugar content in the blood, which can damage artery walls over time. Beyond these, family history, age, and gender are also significant factors. If heart disease runs in your family, you're more likely to develop coronary artery disease. Age is another critical factor because the risk of plaque buildup increases as we get older. Lastly, men are generally at higher risk than women, though the risk for women rises significantly after menopause. Symptoms of coronary artery disease. While some people with coronary artery disease might not experience symptoms in the early stages, the disease progresses over time. One of the most common symptoms is angina, chest pain or discomfort that occurs when the heart muscle doesn't get enough blood. Angina can feel like pressure, tightness, or burning in the chest, and it may spread to the arms, neck, jaw, or back. The pain can be triggered by physical activity or emotional stress, and it typically goes away with rest. Another serious symptom is shortness of breath. As the heart's ability to pump blood decreases, the body struggles to get enough oxygen, leading to difficulty breathing. Fatigue, dizziness, and weakness may also be signs of a heart that isn't functioning optimally due to reduced blood flow. Unfortunately, for many people, the first indication of coronary artery disease may be a heart attack. Heart attacks occur when blood flow to a part of the heart muscle is completely blocked, often due to a ruptured plaque and the subsequent formation of a blood clot. Symptoms of a heart attack include intense chest pain, shortness of breath, nausea, and cold sweats. Immediate medical attention is required to prevent severe damage or death. Diagnosing coronary artery disease. Diagnosing coronary artery disease involves a combination of medical history, physical exams, and diagnostic tests. Your doctor will assess your symptoms and risk factors before recommending specific tests to confirm the diagnosis. Some of the most common tests include an electrocardiogram, ECG, which measures the electrical activity of your heart, and a stress test, which evaluates how your heart performs under physical exertion. Imaging tests such as echocardiograms, coronary angiography, and CT scans may also be used to visualize the heart and blood vessels. These tests help doctors identify blockages or areas where blood flow is restricted, allowing them to pinpoint the extent of the disease and tailor treatment accordingly. Available treatment options. The treatment of coronary artery disease depends on its severity, but the goal remains the same: to restore proper blood flow to the heart and manage symptoms effectively. Treatment strategies can range from lifestyle changes and medications to more invasive procedures like surgery. The first line of treatment is often lifestyle modifications. Doctors recommend adopting a heart-healthy diet, rich in fruits, vegetables, whole grains, and lean proteins. Reducing the intake of saturated fats, cholesterol, and sodium can significantly lower the risk of further plaque buildup. Physical activity is another essential component of managing CAD. Regular exercise, such as walking, swimming, or cycling, helps improve cardiovascular fitness and lowers blood pressure and cholesterol levels. Smoking cessation is critical for those who smoke, as smoking is one of the most preventable risk factors. Quitting smoking can halt the progression of plaque buildup and improve overall heart health. Managing stress is also important, as chronic stress can lead to elevated blood pressure and heart strain. Techniques such as mindfulness, meditation, and deep breathing can help. If lifestyle changes alone are not enough, medications are often prescribed to control the disease. Common medications include cholesterol-lowering drugs like statins, blood pressure medications like ACE inhibitors or beta blockers, and blood thinners to reduce the risk of blood clots. In some cases, medications that relieve chest pain, such as nitroglycerin, may also be prescribed. When coronary artery disease is more advanced, surgical interventions may be necessary. One common procedure is angioplasty, where a small balloon is inserted into the blocked artery and inflated to widen the passageway. A stent, or small metal mesh tube, may then be placed in the artery to keep it open. For more severe cases, coronary artery bypass grafting, CABG, might be performed, where a surgeon creates a bypass around the blocked artery using a blood vessel from another part of the body. This allows blood to flow freely to the heart once again. Another advanced treatment option is enhanced external counterpulsation, EECP, a non-invasive procedure that stimulates blood vessel growth and improves circulation in patients who cannot undergo surgery. Living with coronary artery disease requires long-term management, but with the right approach, many people can lead full, active lives. The key is adhering to your treatment plan, making sustainable lifestyle changes, and working closely with your healthcare provider to monitor your condition. Regular checkups are crucial to assess the effectiveness of treatment and adjust medications or strategies as needed. Support from friends and family is also important, as living with a chronic illness can be emotionally challenging. Having a solid support system can make it easier to stick to a healthy lifestyle and manage stress. Outlook for coronary artery disease patients. While coronary artery disease is a serious condition, advancements in medical research and treatment options have dramatically improved the outlook for those diagnosed with it. Many patients, with early intervention and consistent management, can prevent the progression of the disease and avoid major complications such as heart attacks. Early diagnosis and a proactive approach to treatment are key to improving quality of life and long-term survival. With a commitment to making heart-healthy choices and following medical advice, you can significantly reduce your risk of complications from coronary artery disease. The earlier you start managing your risk factors, the better your chances of preventing severe outcomes. That wraps up today's in-depth look at coronary artery disease. We hope this video has provided you with valuable insights into understanding the disease, its causes, symptoms, and the treatment options available. Remember, your heart health is in your hands, and small changes today can lead to a healthier tomorrow. If you found this video helpful, don't forget to like, share, and subscribe to Expert Living for more expert advice on staying healthy and informed. If you have any questions or topics you'd like us to cover in future videos, let us know in the comments below. Thanks for watching, and take care of your heart.